Welcome to Novamind's AGACNP review on bite. I am using information from the Barclays AGACNP live review course and ANA's review course that I took and formulated this study guide, and I'm just sharing it with you in hopes that it helps somebody. Let's get started. So, which bite is the highest risk for infection? Would it be A, cat, B, dog, C, human, or none of these are at a high risk for infection? If you said cats, you're right. Let's be honest, all bites have a potential for infection. But cat bites pose a higher risk for infection primarily due to the unique dental anatomy and the nature of the wounds they inflict. Here are the key reasons. So, sharpness and pointed teeth. Cats have sharp teeth. They're pointed. That can create deep puncture wounds. These wounds may appear small on the surface, but can be quite deep, reaching into the muscle or tendons. The deep tissue perforation can deposit bacteria from the cat's mouth into the tissues beyond the reach of the effective cleaning and disinfection that we do from the surface. So bacteria in cat saliva also has such a well-known bacteria named Pasteurella multicida. I probably said that wrong, sorry guys, which is known to cause rapid and severe infections. This bacterium is present in the majority of cat bites and wound infections. So that's another reason. And then there's reduced oxygen exposure. The deep puncture wounds close quickly at the surface, creating an oxygen-poor environment, which is conducive to growth of anaerobic bacteria. And then the wound healing nature of these puncture wounds makes them heal over the surface quickly, again, trapping bacteria inside and making it harder for the immune system to reach and address the infection. Due to these factors, cat bite wounds have significantly higher rate of infection compared to the dog bites or even human bites, and they often require prompt medical attention and antibiotic treatment. When treating wounds that are from cat bites, the antibiotic that we want to prophylactically use first line is your amoxicillin clavulinate. It is advised to give a 3 to 7 day course of oral antibiotics. For those with penicillin allergy, doxycycline, or fluoroquinolones, or clindamycin in combination with a beta-lactamase resistant antibiotic is appropriate. And the most common pathogens found in the cat's mouth, again, Pasteurella multicida. Cat bites and wound management. Immediate high pressure irrigation vigorously with normal saline will help reduce the infection risk. And then consider debridement if you see any foreign materials or maybe there's some necrotic tissue. There should be no primary closure, so no stitching, and generally avoided for cat bites due to the infection risks that we talked about earlier, and allow the wound to heal by secondary intention. So that's your natural healing process. We also want to monitor closely for infection in these patients. Next, let's talk about dog bite. When we're treating dog bites, the decision to use antibiotics depends on the severity of the bite and the location and the patient's medical history. Prophylactic antibiotics are generally recommended for those moderate to severe bite, puncture wounds, wounds to the hand, face, or over any joint. And in the patient with immunocompromising conditions, definitely want to give a prophylactic antibiotic. And just like the cat bites, amoxicillin clavulinate is also commonly used for dog bites. Additional treatment measures include thorough cleaning and irrigation of the wound, and we'll talk more about the tetanus prophylaxis as needed and maybe rabies prophylaxis depending on the circumstances. We also want to make sure that we do close follow-up and monitor for signs of infection. And patients should be educated about what symptoms should prompt return to the healthcare facility. It's important to consider each case individually and base treatment based on the specific circumstances on the bite. This is for both cats and dogs. But for the wound closure, again, leave open secondary intention. And in general, any wound to the hand or lower extremities, or if they're older than 6 hours with bites, should be left open. Let's talk about human bites. So with human bite, there is a high risk of infection due to the diverse bacteria in the human mouth. The most particularly concerning are Eikenella corridens, streptococci, staphylococci, and anaerobe. When doing a wound assessment, you must assess for the depth, location, evidence of tendon or joint involvement. You also want to consider the mechanism, occlusion bite versus clenched fist injury. Also, when we're doing the wound cleaning and care, it's really important to immediately and thoroughly irrigate with normal saline. Debridement may be necessary for more severe wounds. Human bites, we also generally avoid primary closure to reduce infection risk. Now, there is some controversy around giving prophylactic antibiotic in human bites, but according to both review courses, we want to go ahead and prophylactically treat human bites. The antibiotic, again, is the same as for cats and dogs, so this should be easy to remember. It's the amoxicillin clavulanate, and that's, again, a 3 to 7 day course of oral antibiotics that you want to prescribe. Animal bites, particularly those causing deep puncture wounds, can increase the risk of tetanus. Tetanus is caused by the bacterium Clostridium tetani, which can be present in soil, dust, and animal saliva. Evaluate the patient's tetanus immunization status immediately. A booster is typically given if the patient hasn't had a tetanus shot in the past 5 years for a dirty wound or 10 years for a clean wound. So indications for tetanus prophylaxis include that the tetanus toxoid booster is indicated for unimmunized or incompletely immunized individuals. In cases where the patient's immunization status is unclear and the wound is severe, the tetanus immunoglobulin, TIG, might also be administered alongside the vaccine. So I wanted to clarify the difference between the tetanus booster, which is tetanus toxoid, and the tetanus immunoglobulin, which is TIG. So the indications for a tetanus toxoid or your tetanus booster is administered to individuals who have completed their primary tetanus vaccination series but are due for a booster. A booster is generally recommended every 10 years, but in the case of contaminated wounds like in the animal or human bite, it may be given if more than 5 years have elapsed since the last dose. The purpose is to boost immunity against the tetanus, helping the body's immune system to quickly respond to the tetanus spores that might be entering through the wound. Now, the tetanus immunoglobulin, TIG's indication, it's given to individuals who have never been vaccinated against the tetanus or their vaccination status is unknown or incomplete. Also considered in severe contaminated wounds, even if the patient's last booster was within 5 years, based on clinical judgment. The purpose of this is to provide immediate passive immunity. TIG contains antibodies that neutralize tetanus toxin. I really hope that was helpful. In the review courses, X-rays are indicated for bites of the head and face, but just to get a little bit more thorough, indications for X-rays in bite injuries is when first, there's a suspected foreign body, so you can use X-rays to detect maybe retained teeth, fragments, or other foreign bodies in the wound. Another reason would be that there's a deep puncture wound, particularly with cat and human bite, if there's a concern that the bite may have penetrated to the bone or the joint. Bite locations near joints or bones are indications for X-rays, and it's used to assess for bone involvement such as a fracture or osteomyelitis, especially in bites to the hands or feet. Signs of bone or joint involvement, if there are those clinical signs suggesting involvement of deeper structures such as severe pain, reduced range of motion, or evidence of a crush injury, this is a time to get that X-ray. If there is a suspicion of gas formation, to check for gas in tissues which may indicate a necrotizing infection or clostridial myonecrosis. Also, chronic wounds in cases where the wound is not healing or expected to rule out any underlying osteomyelitis, that would be a good time to get an x-ray. And maybe during assessment of post-treatment, in some cases, follow-up x-rays may be necessary to monitor the progression of the bone or joint involvement. So just to get a little bit more in depth about rabies and bites, assessment of rabies risk, this would be consider the type of animal, wild versus domestic, the animal's vaccination status, and the circumstances of the bite. Is it provoked or unprovoked? Now, wild animals, particularly bats, raccoons, skunks, and foxes, are most likely to carry rabies. The rabies prophylaxis decision, if the biting animal is a domestic pet with an up-to-date rabies vaccination, it may be observed for signs of rabies rather than immediately starting the prophylaxis. For bites from wild animals or unvaccinated domestic animals, or if the animal cannot be observed or tested, rabies prophylaxis should be considered. The rabies prophylaxis protocol consists of two components. It's the rabies immune globulin, which is RIG, and rabies vaccine. The RIG is given once at the start of treatment to provide immediate antibodies, and then the rabies vaccine is administered in a series of doses over a specific period. Example on days 0, 3, 7, and 14. It's important documentation and reporting. Document the bite, incident, assessment, rationale for administering or not administering your prophylaxis. In many areas, animal bites are reportable incidents. Be aware of your local public health reporting requirements and educate the patient about the importance of completing the rabies vaccine series. Inform them about the signs and symptoms of rabies. Always follow up, arrange a follow-up care, and ensure completion of the vaccine series, and monitor for any signs of infection. Considerations for immunocompromised patients: exercise additional caution and consider prophylaxis in cases involving immunocompromised individuals, as their response to the vaccine may be diminished. The key takeaways again is for the boards is to make sure that you are addressing the animal rabies vaccination status. In the review courses, there was a very slight mention about penicillin allergies, but I wanted to make a slide that clearly identifies the route that you want to take when your patient has a penicillin allergy and has a human or animal bite. So with cat bites, doxycycline is the number one choice as the alternative for penicillin allergy. It's effective against a broad range of bacteria commonly found in cat bites. Fluoroquinolones like ciprofloxacin is effective against a wide range of bacteria, so that is another alternative that you could use, but use this one cautiously due to the potential side effects and the resistance issues. Another alternative is clindamycin plus the TMP-SMX, and this covers most of the pathogens involved in cat bites, including anaerobes. For dog bites, again, doxycycline is one of the effective penicillin allergy alternatives. It is effective for dog bite wounds, especially for broader coverage. And then we have, again, a second alternative, fluoroquinolones like ciprofloxacin. Again, that's useful in treating a range of infections from dog bites. And third, we have the clindamycin plus the TMP-SMX, just like for cat bites. And the combination provides broad coverage, including for anaerobes and the Pastorella species. For human bites, the patient that has a penicillin allergy, clindamycin plus the cipro or the TMP-SMX is the best alternative. This combination covers the broad range of bacteria typically found in human mouth. This is including the Eikenella corundus, anaerobes, and aerobic bacteria. As a summary, again, that I received from the review courses, it is known that all bites can lead to infection. Always give amoxicillin clavulanate. Immediate high-pressure irrigation with normal saline, and the wound should be left open, especially if it's hands or lower extremity wounds like your foot. and any wounds that are greater than 6 hours old. Any animal bites, you want to make sure that you ascertain their rabies status and make sure that you provide x-rays as needed, example for head, skull, and face bites, and plastic surgery consults as needed is something to always consider. So what questions do you have? Comment below and I will look them up if I don't know it, and let's have a discussion because I really enjoy interacting with anybody that is also has any information on this